I'll be talking about the speech disorders and diseases of the nervous system, like aphasia, dysarthria, and anarthria. Speech sound disorder definition, it's a communication disorder characterized by persistent difficulties in phonology. It can be with or without articulation defect. Diagnostic criteria: impaired verbal communication and speech intelligibility due to persistent difficulty in speech sound production. The communication difficulties can cause patient to feel shy and not participate socially, or poor academic performance in childhood. Speech difficulties begin during the early development period when the child just starts to grow and starts to speak, learn how to speak. The symptoms are not due to the underlying conditions, like example, hearing impairment or cleft lip or cerebral palsy. There are other factors that are responsible, like problems in the nervous system. Differential diagnosis: we can basically diagnose if we see a speech delay in children, especially. Expressive language disorder: the patient is not able to express themselves. There can be hearing impairment, selective mutism, etc. Management: we can take the patient to a speech therapist and to find out what is the problem in phonology or articulation, and then solve the problem accordingly. Speech disorders, there are types, like if there's a process of speech, the person is not able to hear, the abnormality is deafness, of course. Understanding: aphasia. Thoughts and word processing: aphasia. Again, if there's voice production, like articulation defect, dysphonia, or a dysarthria, like that. Aphasia: it's the inability to produce or understand the verbal or written language, which is caused by the pathology in the dominant hemisphere, which is usually the left hemisphere. In contrast with dysarthria, there is no motor dysfunction of the vocal apparatus, meaning there is no articulation defect. There are types of aphasia given in the table. So we can see, for example, if there's Broca's aphasia, the comprehensive preserved except for the grammar. Language is impaired, naming is impaired, fluency is decreased. So just like that. This is just an example of a patient with Broca's aphasia, how the patient would write. There's a difficulty in understanding the letters and everything. Dysarthria occurs when the muscles you use for speech are weak or have difficulty controlling them. So articulation defect. Dysarthria often causes slurred or slow speech that can be difficult to understand. The causes, as I mentioned earlier, okay, there are types and causes, like lower motor nerve dysarthria, upper motor nerve or spastic dysarthria, extrapyramidal dysarthria, rigid dysarthria or Parkinson's, hiccup speech, chorea, and Michael. It's just a name, official name or the scientific name for that. There are some medications such as sedatives and seizure drugs, which can also cause dysarthria. The types of dysarthria, again, the Broca's can be responsible. There are other factors as well. In Broca's, it's the same picture actually. Same thing. Conduction is preserved for comprehension. Language is preserved. Naming is impaired. Fluency is preserved. So, types of dysarthria. Okay. So I've mentioned just few of them over here. Spastic dysarthria, as the name suggests, this speech pattern is characterized by the burst of sound as you try to speak. The patient tries to speak, but there's the damage to the pyramidal tract. So the speech is not proper. The hyperkinetic dysarthria, this is a speech caused by the lesion of the basal ganglia, region of the brainstem. Hypokinetic dysarthria, this is a pattern of speech associated with Parkinson's disease. As we have the ataxic flaccid and the mixed dysarthria, which is the combination of dysarthria types caused by the damage to several regions. Like, for example, if there is a damage to the upper motor neurons plus lower motor neurons, so there will be mixed dysarthria. So the difference between aphasia and dysarthria. Anarthria and dysarthria are not caused by problems with the language comprehensive or with problems with thinking or finding the right word, but problem with the articulation, understanding. Aphasia is basically the speech problem caused by production or understanding the speech, but dysarthria is due to the articulation defect. The person knows the word, knows everything, knows how to speak, but because there is a problem in the articulation, the words come out uh, something different, and the person is not able to understand. Anarthria, a severe form of dysarthria. It's similar to dysarthria, but more severe form. It is the inability of to speech due to impaired neuromuscular control of the muscles used for speech. So it's same as dysarthria, just that it's the severe form. And this is just the picture to understand the areas of speech in brain. You can see the Broca's area, Wernicke's area. There's meninges of words like perceptions and memories. So any damage to this, any part of this areas would cause speech disorder. Thank you.